Hi, everyone. Well, we have had 3 fantastic speakers, and we have got one last, 4th fantastic speaker to round off the evening. So I'm going to get going quickly because I know we're running late. So Timo is part of Lauri University of Applied Science in Helsinki in Finland, which is one of the probably most established and well-known universities with Living Lab connections. He's involved in a whole series of Living Lab projects. But tonight he's here to talk about a groundbreaking study last year that he published and was involved in called the ProVaHealth study. And in particular, we'll be looking at living lab business models, but also kind of returning to a question we started with: what difference does a living lab make to SMEs and startups? So without further ado, I'm going to hand over to Timo for his presentation.
Okay, thanks. I'm happy to be here. I'm calling from this snowy and cold Finland, so probably you don't have the snow at the moment over there. So yeah, and it's afternoon in here. But anyway, I start sharing my slides. Can you see my slides?
Yep.
Yes, thanks.
Okay, that's good. Okay, like it was said, so I'm talking about the lessons learned in product validation in health, ProVaHealth project. Let's see the. Okay, and it was quite extensive project. The main aim was to support startups and SMEs to commercialize their solutions and scale up in the international market by utilizing this living lab approach. And as well, what we were trying to do is kind of develop the transnational living lab collaboration between the partners who were involved. And we had 17 partners across the Baltic Sea region. So basically, we have 8 countries: Finland, Sweden, Denmark, Germany, Poland, Lithuania, Latvia, and Estonia. And it was quite well funded, the 3 million euros projects. And in our understanding, this is the biggest project so far, which has been focusing on these kind of areas. And our target industry was health and well-being. So that was which is of course heavily regulated area and gives a certain kind of challenges to do a living lab research. And today, the things that I'm talking about, these are these 2 key publications which are referring the results in our projects. So you can find them. These slides will be shared with you, so you can find them from these links. And I understood that you've been already discussing about what is Living Lab, so I don't have to be kind of going through that. But let's dig down more deeply in the Living Lab innovation process and services, because those will be having an impact on the business models as well. So what we follow in a way that when we have an initial challenge, and we have to be ending up in the validated market-proof solutions, and what are the steps in between. And first of all, what we have to do is to make sure that we are developing the right thing. And the second phase is that we are making sure that we are developing things right once we know what we are doing. And in here, we follow typically in this kind of a service design process, which starts from the discover phase. First of all, understanding what is the problem. And this often referred as a double diamond model. And as you see, the diamond is like an expanding in this phase, indicating that we are collecting as much as information as possible. And the second phase is defining, framing, and consolidating and clarifying what is the actual challenge and problem to do. And as a result, we will have a shared vision and understanding about what should be done. Because anyway, typically, you are not able to do everything, but you actually have to be selecting what kind of issues you are focusing. And then we actually start the actual ideation and prototype thing by co-creating the solutions, and then delivering, testing the solutions with the real users in real life settings. In order to do that, what you have to do is then kind of orchestrate the innovation ecosystems where you are operating. Basically meaning that you have to be engaging the crowd, the end users, but also the different kind of experts and service providers and companies who are delivering these solutions. And there are I would highlight that there are iterations between the phases, and depending on what kind of an outcomes each phase kind of delivers, you can go back and forth between the phases even, and maybe in sometimes in test and review results you have to go back on the first phase. And you are applying kind of a different kind of a multi-method research approaches based on the things that what you are doing. And hopefully, at least in our aim is that also always to kind of generate open data from all phases in order to share the knowledge between the different kind of players in the ecosystem. And in a way, in many cases, what phases are included in a living lab process, in some people think that the living lab process is mainly focusing on the testing, but that's not our understanding. If you think about the solution maturity scale from low to high, and in a way that when the innovation process matures, when you're spending more time, what we do in a way always is that niche challenge and opportunity identification at the first stage, idea generation and testing the ideas. And of course, if your idea is not good enough, then you have to go back. Then you typically do concepting and prototyping. You go to detailed development, to actual validation and impact assessment, and market launch and post-market studies. And what is important in here that, of course, the information about the solution increases when you go further on the process. But also the cost of doing that solution increases when you go further. But importantly, the ability to make changes, it's much easier in the early phases of the innovation process. And this is one of the things that we've been finding quite a lot when operating SMEs, that they enter to this living lab process too late. So they already have kind of in their opinion, a solution which is working or nearly working. And when we're doing testing, we will kind of realize that, okay, it's not addressing the needs that the actual customers or the users has, or in a way the functionality is not that it's not in the level that user will be accepting the solution. So my message in here is that the earlier you get in the process, the better it is for your development. In here, we also, during the process, we evaluated the kind of what kind of basic needs SMEs and startups has for the living labs. So basically, what kind of services they would be looking for them. It's a little bit small picture, so I've been kind of doing an extraction of this picture. But the most important things are these columns. In order to do and operate, Living Lab has to orchestrate the innovation process. And at least in Europe and in Nordic countries, you know, that we are also providing funding support. Basically, because I'm coming from the university, we are the ones who are writing the funding applications in order to gain new projects, and for that we try to engage the companies to be involved. But in many cases, the writing task what the companies has to do is quite limited in that sense. And of course, then you have to do a project planning and project management once you do entering in the Living Lab process. And then in here, you actually have the main key elements of the Living Lab innovation process. You do the market and competition intelligence services, you co-create product services and processes, and you do the testing and validation. In some cases, also companies requires this business advisory, management consulting, and marketing and sales support, which also, of course, are often provided some consulting services or the kind of startups and accelerator and companies. But in here, I would be highlighting for market and sales support is in many cases, once the company gets some kind of a certification or some kind of a validation that our solution is actually working, what we call like a user approved certificate based on the results that has been done as a part of this innovation process. Those are really valuable for the companies, especially if they are startups and they do not have any customers yet, and gaining the visibility or the access to the right persons who might be able to buy their solution. And in healthcare sector, in Nordic countries where I come from is kind of complicated, and in most cases, especially the startups who are coming to from the other industries to healthcare industry, they don't have an understanding how the healthcare industry is actually working and how the public sector is working. So it takes some time for them to understand how it's working, and that's why they need the support from the different players to make the right connections and explain that how the research process is working over there. And then the living lab business models. In here you can see this kind of a complex heat map, but it's pretty simple once I explain it. In the left-hand column, we have the key business model elements based on the business model canvas, which is probably the most well-known business model framework to analyze and generate new business models. You have the key
I think we might have just lost Timu.
Who are your key partners and what are your key activities? And after a few iterations, we consolidated all the items within each of the elements. And for example, key partners, that the green is indicated that was heavily emphasized between the living labs, and the red one is saying that okay, that wasn't that important for them. But when I switched these two columns, the first one was the now, which was the collected the data at the time of the study when we collected the data. And then we also asked that the relative importance in 2021. And as you see, all of these items are kind of a switching, the much more green, which indicates that the living lab business models are actually changing. I don't want to go too details about this, what are the actual elements, because there are 101 elements over there. But in a way, especially if you're working in the healthcare sector and well-being, this is pretty much quite comprehensive items that are included. And of course, part of these are applicable also to some other industries as well. But my message in here is that like I said, the living lab business models are not stable. They are actually evolving, because still the living lab as a research approach is evolving. In here, we were calculating that if the living labs were marking the highly important, so that would all the items highly important, that would get 100%. And this scale from here is from future perspective. And we identified 3 different main models. The first one is the maxed out business model, indicating that that particular living lab thinks that most of the items in the business model canvas were important. And on the left-hand bottom corner, what we call focused business model, indicating that those living labs had selected only few items as important, while most of the living labs were considering as a balanced business model. So some items are important and some are not. But as you see in here, we see that the more items are coming important. And in here, we can see that how the models are changing between the different living labs. One of the players was trying to do frog leaping. So basically meaning that they didn't emphasize a lot of the items highly, but in the 2021, they were trying to really boost their activities. And only few players were kind of fine tuning their solutions, and most of they're doing it.
Timo, you seem to be breaking up.
Yeah, we might have just lost Timo there for a minute.
Yes, let's wait till he comes back, and then he might be able to repeat the last few sentences, but also we should advise him to turn his video off. That might help a bit.
Oh, sorry. Is this okay now?
It's okay now. Would you be able to share the screen and repeat the last few sentences? And
Yes.
it might help if you would maybe turn off your video to give you a little bit of bandwidth.
Yes. Put this one. Too long connection. Yeah. So do you mean this slide or this slide?
That one, you were just talking about leapfrogging.
Okay. Yes. Yeah. Okay. So basically, this kind of indicates that how much the different living labs are changing their business model. And we have one player is doing the frog leaping, basically indicating that they were trying to emphasize much more item heavily in the future. And only few players were kind of stabilize their business model and doing this kind of fine tuning for their business model. And majority of the player was either doing the minor adjustments or rescoping, and rescoping indicating that there were a little bit more changes. And as we see from this figure in here, those one who had the focused business model indicating that they've been selecting only few items important, they were doing frog leaping or rescoping in here. So key findings from the Living Lab business model is that we argue that Living Lab should be establishing as many partnerships as possible, because we noticed that the partnership has tendency to lead also to the customer relationships. So in a way, the partnership is very close, at least in the healthcare sector. In a way, you need a partnership, but they can be actually at the same time your customers. And we notice also that the NGOs were kind of underrepresented as the partners. And like I said, this is important because the partnerships can stimulate new customer relationships. And in here we also, because the Living Labs that were participating on this project, they had a different background. We have, and that's why the partnerships model were differing between the players. We have the citizen-driven, basically kind of, and the focusing more the citizen collaboration and NGO-driven things. Local authority indicating that you were more tightly connected to local municipality or local town. Industry was indicating that you have the kind of the industry, more tight industry connection, and even one Living Lab space based on this kind of a state level cluster approach. And then what we call the intermediary or widespread partnerships, where the players who were kind of combining multiple approaches in here. But my message in here that the operating environment that where you are operating, that will kind of dictate a bit also about your partnership models. And at least in Baltic Sea region countries, the revenues was currently and in the future heavily based on project grants or the basic fixed funding. But they've also kind of the tendency to diversify the revenue sources in the future. And at least in our setting, the economical suitable business model at the moment requires support from the policymakers. And the cost structure wise, now and in the future, the personnel costs are the most important ones. And often is say that, okay, Living Lab should have the kind of a unique infrastructure, whatever that is meaning, because you can have the certain kind of facilities or technologies that you could be utilizing. What we say is that that those costs are expected to increase, but this unique infrastructure always kind of involves a risk, because there were some cases that the Living Labs were invested on this kind of an infrastructure, but it appeared that there was not enough on market demand for using that infrastructure, so they had to be dropping the infrastructure. And they were clear intention to invest more on marketing and sales. And in a way that we call that living lab business model are multi-phased, but common elements can be found. So I would be saying that like I said earlier, that the environment that you are operating, that kind of dictates that also a bit about your business model. And for example, in most of the cases in our network, it was that the living lab was not a single entity, but it was part of some other organization. Like for example, in our case, we are not a single entity as a Laurea Living Lab, but we are part of the university. So that kind of sets things that what we are doing and what are our strengths and weaknesses. And this kind of also make the transnational collaboration between living labs a bit more complex, because they have a different objectives and aims and capabilities and skills. But on the other hand, if we look from the different angle, we could be saying that through such as ENOL, the network of living labs can offer all-inclusive R&D services. And the focused, balanced and maxed out business model strategies have been applied. And that, like I said, the business models are about to change in the future, and this is a heavily personnel cost related activity. And then as a part of that project, we also have this kind of a transnational living lab collaboration with SMEs and startups. And basically this meant that, there was a companies from the different country, and they came to the Finland or Sweden or whatever other country, and we were running the living labs test for them to making sure or evaluating that would that kind of a solution have market in our country and so forth. And there were the 14 this kind of cross-border collaborations, and it was evaluated through the matching and contracting phase, evaluation work carried out phase, and the future kind of plans, which on the next slide. And the matching and contracting phase, and there was a high level satisfaction between the SMEs and living labs. But the one thing was noted in here is that living labs were kind of thinking about more that this took more time for them to do this process than they kind of they expected. But on the contrary, SMEs even addresses in some cases that a little bit more time would be needed for this space. So in a way, this indicates that either living labs were too optimistic about that, how easily they can get the companies to do a testing and co-creation services through their channels, or in a way. So this is something that you should be thinking about, and especially then highlighting that the more clear services you are offering and more easy they are to understand, this is also kind of helping the matching and contracting phase. And for the evaluation, the work which was actually carried out, and in general, it was said that living labs and SMEs received the quality that they expected, and the expectation in general were high. Of course, there were some significant positive surprises and a few disappointments as well found. And of course, it depends on how the actual testing and co-creation processes were executed. But the other thing that was also noticed that these TRL levels, so technology readiness levels, they were asked to both parties were asked to evaluate the TRL levels, and in a way SME was rating their solution higher than living labs also after the tests. And this is also kind of in line our previous examples that the companies think that their solution is more ready than they are actually. And for the future perspectives, there was a higher degree for SMEs willing to repair the process either with the same living labs or seeking out the other living labs. So this is kind of a positive indication for us in a way that this kind of a way of working is really helping the SMEs and startups to do the work. So in a way that we could be saying that once the SME has tried and experienced the living lab services, they are likely to seek out the similar services. And also in a way, if you're thinking about that, running a test on co-creation in another country that you are not located is typically it's a pretty complex process. But we could be saying that the living labs create value also for SME in this kind of a transnational setting. And at the end, there's a couple of publications where you can be reading more information, and there's a link above that where you can find most of them. And finally, I will be promoting our new project, which is starting on the April. It's Horizon 2020 funded project. And the aim of that project is open and access the health and living labs for the research. It's a pretty big project, 5 million euros, 19 partners and 3 years. And the aim of the project is to offer convenient, effective access to research, offer the living labs as a research infrastructure to do a really kind of real research. And as well, what we are trying to do is to harmonize and health and well-being living lab procedures and data access. So 17 living lab infrastructures in 7 countries, and there will be 3 open calls, which says that the project is offering 400,000 euros to external researchers for conducting the studies. So this is also an opportunity to players outside the project consortium. And in a way, this is partly a continuum of the work that what we did on the ProVaHealth project, and this will have an impact all of the players who are working in this project, because, for example, in our university, we have to be changing our processes to kind of be in line of this project outcomes. But this was pretty much the story that I was planning to tell, so I'm ready for the questions.
Thanks so much, Timo. What a wealth of knowledge, and yeah, thanks also providing all these publications that people can read up on it. There is a question from Phil. Do you think living labs are more robust to scale up new innovation products and services than traditional incubator and co-worker innovation hubs?
I think they are a little bit different in a way, because incubator is, in my opinion, they are more focusing on the still as a helping company as a whole, including all the aspects, funding and stuff like that. And instead of in the living lab process, is more focusing on the make the solution better and make the solution kind of a market ready. So that's in my opinion, that's the key difference in here. So for example, when I was showing what are the key services that living labs could be or should be providing, and for example, this kind of an market, the market landing support and that kind of things, that's more like an I would say incubator kind of things. And our main focus is, I would be saying, is this to understand the market and then co-create the solution and test the solution. And as a part of that, if you want to do that, if you are using public funding money, you have to be, the helping them to get the funding, because you will be get funding yourself as well. So that to me is the key difference.
I'm wondering, for those companies that went through the process, have you got a view on how they're doing now compared to maybe companies that didn't go through that process?
I don't have that data in a way, because I was on the responsibility for that section of the project. And of course, as you know, once the project ends, we are not anymore tracking the companies. Right. But what we know about this was that the tier levels for the companies, because the evaluation which was done afterwards, it was then also asking that what is your tier level at the moment, and generally speaking, it was increased, even though there was few that was actually dropping as well, which indicates that that they understood that their solution is not that ready as they were expecting. And in there, as well as I was saying, the companies still were kind of evaluating their solution more ready than the living labs, even though both did the same test.
Yeah.
You made one comment that it's very different. It has advantages and disadvantages to be located within a university. Can you detail a bit on that comment?
Yeah, I would say that, of course, because we are from university, we have great resources for research expertise, and we are typically, at least we should be very knowledgeable of the latest science, and especially in our case, we are expert on this kind of co-creation and living lab areas. So we know really how to apply these methodologies. And as well in our university, what we follow is that we have this learning by developing pedagogical model, which basically says that we are integrating our students as well for this kind of real life projects. So we have an additional extra resource which some others cannot be doing. But the weaknesses for us is that we don't have kind of a direct access to the end users or patients or whatever, because they are locating either in the hospitals or through the municipal channels. So that's our weaknesses. And of course, we don't have direct access for the companies as well, because of course we are in a part of these networks and so forth. But our key benefit is, of course, the capability of doing a research in a high level.
Thanks for that. We are actually at the end of our time. I see also no new questions in the chat. This was an incredible amount of knowledge across different topics, and I would like to thank again all 4 speakers. Susanna unfortunately had to leave, but Claire and Rebecca, Timo, thanks so much. And I could imagine that some of our delegates, that they are at the moment have to digest a little bit everything they have heard this evening, and they might have an interest to follow up with you. Would that be all right if there are any questions to get in touch?
Yeah, sure. Yeah. And any collaboration ideas are always welcome, especially if there are public funding available or private funding as well. It doesn't matter what money.
Beautiful. That sounds like fantastic opportunities, and congratulations on that project, and we are looking forward to see what's coming out of there.